Hello everyone, we are now going to go over a lymph node flow cytometry from a 25-year-old man who presented with cervical lymphadenopathy. So this is a lymph node specimen. So as we expected, majority of the cells are in the lymphocyte gate that is characterized by a bright CD45 expression and low site scatter. When we see the lymphocytes, 60% of them are more than 60% are CD20 positive. So those are our B cells. And there is a small number of cells that express CD10, and these seem to have brighter CD20 than the rest of the B cells. Our B cells are negative for CD34, and in kappa versus lambda, we see a polyclonal kappa lambda ratio, slightly more kappa than lambda, but it still is in the 1.5:1 ratio, and it's still in the normal range. And here again, we see a nice distribution of kappa lambda polyclonal B cells. And they have selected just the CD10 and 20 positive B cells, and they gated that and tried to see the kappa lambda distribution of those cells. And again, those cells show a polyclonal kappa lambda ratio, a little more lambda skewed, but still looks polyclonal. And in CD20 versus 71, again, we see that bright CD20 positive population, and that is also expressing CD71. Now in tube 2, we can separate the T and the B cells, and we have CD19 and CD5. Our B cells are positive for CD19, negative for CD5, which is normal, and our T cells here are positive for CD5. Our B cells express partial CD23, which is normal, and there is a small population that expresses bright FMC7. Rest of it is partially positive, normal. The CD200 is partial, which is normal, and kappa lambda shows a polyclonal ratio, and there are like very few scattered events here, which they have gated the 19 positive, 5 positive B cells, which are also polyclonal. So the other finding is that the B cells are negative for 103, and we have again a 19 positive, CD38 positive population. Similar to what we saw in CD10 and CD71 plots, we have a separate population. So basically we have a population of B cells, a small subset, maybe 6%, that expresses bright CD20 than the rest of the B cells, and these cells are positive for CD10, CD71, and CD38. So this is a cervical lymph node, and the patient has lymphadenopathy. So just wanted to bring it to your attention that sometimes you can have a reactive lymph node showing exuberant follicular hyperplasia. And when you have that, the germinal center B cells, normally germinal center B cells express CD10, right? And when you have that and you get a lot of germinal center B cells in your specimen sometimes, and they can be CD10 positive, and they usually have, that is the germinal center B cells usually have brighter CD20, and they co-express CD71 and CD38. So we want you to remember this because, under normal circumstances, the germinal center B cells are polyclonals. Just like here, the kappa lambda ratio is a little lambda skewed, but however, they are still polyclonal. But sometimes they can be very kappa skewed or even give an appearance of a kappa restriction. And the population here is scant, just 6%, but sometimes you can see a considerable, a sizable population that is kappa skewed or kappa restricted, and that sometimes confuses with follicular lymphoma. So to distinguish that, always morphology helps. The other clue is that when we have a reactive follicular hyperplasia, the pattern of the light chain expression would be more like this, like kind of, scattered population rather than a tight cluster that you would see in a monoclonal B cell population that you see in lymphomas. It will be more of a smeared pattern or a scattered pattern, just like what you see here. So correlate with morphology and also pay attention to what is the pattern of the light chain distribution in these cases. Thank you.